Could your daily workout actually be putting your brain at risk? It's a shocking question.
For millions of adults over 50, especially, the answer might be yes.
We exercise to stay strong and independent. But what if popular exercises are quietly increasing your stroke risk and no one is warning you?
Hi, I'm glad you're here. Today's video could literally change the way you move.
And maybe even save your life.
We'll reveal 10 common, even recommended exercises that may be dangerous if you're over 50. Especially if you have high blood pressure, stiff arteries, or a heart rhythm issue. But don't worry, this isn't about stopping exercise. We'll show you how to move smarter and safer. We'll show you how to move smarter, safer, and still get strong without risking your brain health. And stick with me until the end, because tip number 9 is something almost everyone does, and doctors are now sounding the alarm.
Let's get into it.
Exercise 1. Heavy overhead lifting, especially while holding your breath.
If you're lifting heavy overhead or holding your breath, you could be unknowingly raising your stroke risk.
Overhead lifting causes your blood pressure to spike dramatically, sometimes reaching 300 over 200 millimeters of mercury. During exertion. That's not a typo. This sudden surge is largely due to the Valsalva Maneuver, holding your breath and straining.
This creates the perfect storm for a brain hemorrhage or ischemic stroke, especially over 50.
Smarter alternative, switch to moderate resistance training with proper breathing.
Use machines or resistance bands. Focus on controlled movement, not maximum weight.
Exercise 2. Burpees. Fast, intense, and risky. If you're over 50, burpees could be doing more harm than good. Rapid transitions from standing to floor and back up can lead to orthostatic hypotension.
This sudden drop in blood pressure causes dizziness or even fainting.
Neurology International 2021 states these fluctuations can restrict blood flow to the brain,
Increasing the risk of mini-strokes in older adults.
Smarter alternative. Try low-impact cardio circuits like gentle step-ups or slow mountain climbers. Exercise 3. Hot yoga. Sweating may feel good, but it can be dangerous.
Heat to 95 to 105 degrees causes excessive sweating, dehydration, and thicker blood viscosity.
This raises the risk of blood clots and reduced blood flow to the brain.
Harvard Medical School found older adults experienced increased cardiovascular strain. Smarter alternative. Choose room temperature yoga or chair yoga.
Exercise 4. Box jumps. Explosive power, dangerous pressure.
Explosive movements cause a sudden spike in intracranial and systolic blood pressure.
A 2020 study in European Journal of Preventive Cardiology found BP surges up to 260. That's high enough to rupture weakened cerebral arteries in those with hypertension.
Smarter alternative. Replace box jumps with controlled step-ups or sidestepping drills.
Exercise 5. Long-distance running. Risky without monitoring.
Unmonitored endurance running can lead to atrial fibrillation, Afib.
An irregular heartbeat that significantly raises stroke risk.
Mayo Clinic Proceedings 2019. Older endurance runners were more likely to develop arterial stiffness and Afib.
Smarter alternative. Choose brisk walking, cycling, or swimming, and always monitor your heart rate.
Exercise 6. Abdominal crunches or sit-ups. These can do more than just strain your neck.
The sudden compression of the abdominal region during a crunch significantly elevates intra-abdominal pressure.
This pressure is rapidly transferred to the chest and brain, spiking cerebral blood pressure.
The danger is amplified if you unconsciously hold your breath while contracting. It's a double whammy.
The Journal of Stroke and Cerebrovascular Diseases noted that intense isometric exercises.
Smarter alternative, try dynamic planks or controlled bird dog exercises.
And at Tankful these engage your core muscles without the high pressure and sharp flexion.
Exercise 7. High-intensity interval training to exhaustion. Not all intensity is good intensity.
Pushing to maximum heart rate and muscle failure rapidly increases stress hormones and causes vascular overload.
This level of overload can cause oxidative stress, damaging vessel walls, and contributing to atherosclerosis. Research from the American Heart Association showed chronic high-intensity strain may accelerate age-related cardiovascular decline.
Smarter alternative, choose high-volume interval training assembly.
This means working at 60 to 70% of your maximum effort, with longer rest periods.
Exercise 8. Fast kettlebell swings. A popular move that's high risk for your back and your brain.
The explosive hip extension during a fast swing, especially with a heavy weight, creates a rapid, high-intensity blood pressure spike.
This resembles the pressure surge we saw with overhead lifting and increases the potential for vertebral artery dissection.
The Canadian Journal of Neurological Sciences found exercise-related cervical artery dissection is a leading cause of stroke in young adults, but risk persists with age.
Smarter alternative, use slow, controlled hip hinge movements like dumbbell Romanian deadlifts.
And focus on feeling the deep glute and hamstring contraction, not on generating momentum.
All right, we're almost at the big payoff. Let's talk about a silent killer hiding in your gym bag.
Exercise 9. Aggressive neck rotations and stretches. This is the one almost everyone does without realizing the severe danger.
Aggressive neck movements, like full, sharp rotations or rapid side bends, can cause cervical artery dissection.
This is a tear in the wall of an artery in your neck, which leads to blood clotting.
The clot can then travel directly to your brain, causing a major stroke. This is not rare.
People think they're doing a simple stretch, but they're creating a literal hazard at the base of their skull. Smarter alternative, stick to gentle side-to-side, ear-to-shoulder stretches, holding each position.
Exercise 10. High-speed spinning class, where intensity meets rapid positional changes.
The combination of extreme heart rate spike and quick, repetitive movements from sitting to standing can cause significant blood pressure volatility.
This volatility puts chronic stress on the cerebral vessels, similar to the orthostatic hypotension we discussed earlier.
Smarter alternative, reduce your intensity on the bike, focus on a smooth, consistent pace.
Avoid the aggressive jumps out of the saddle. Keep your resistance moderate and monitor your heart rate zone.
Remember, the goal is not momentary peak performance, but lifelong health and independence. I'm Dr. David Harrison. Thank you for making your brain health a priority today. If you found this video helpful, please like and subscribe.
And click here to watch our next video on the 5 surprising foods that can clear your arteries.